Hello to all musculoskeletal pain physiotherapists in Latvia. My name is Wim Dankaerts and I'm a Belgian musculoskeletal physiotherapist with over 3 decades of clinical and academic experience in spine disorders and persistent pain. I'm passionate about bridging science and clinical practice, and I look forward to sharing practical, evidence-based, informed approaches that you can directly apply in your daily work. It is a pleasure to connect with colleagues in Latvia who are dedicated to advancing musculoskeletal and pain rehabilitation. Throughout my career, I've combined clinical practice and research and postgraduate training, always focusing on one goal: translating science and practical, effective strategies that clinicians can apply. As a certified CFT trainer, I'm actively involved in the Evolve Pain Care Academy. I became a CFT instructor driven by a passion to translate strong evidence and clinical experience into practical skills that help clinicians manage complex pain with greater confidence and impact. So what is cognitive functional therapy, or CFT? CFT is an evidence-based, patient-centered, biopsychosocial approach used mainly to treat chronic musculoskeletal pain conditions, especially chronic low back pain. So what does CFT focuses on? Rather than targeting the pain itself, CFT targets the drivers of pain by addressing 3 key areas, like the cognitive and emotional factors, like unhelpful beliefs about pain, fear, catastrophizing, anxiety, and pain-related worry, and functional movement factors, like changing guarded or maladaptive movement patterns, restoring confidence in normal movement by doing graded or gradual exposure to feared activities, and finally lifestyle factors like sleep quality, physical activity levels, stress management, and overall health behaviors. Due to this focus, CFT is often more successful for long-lasting pain because it targets the person's beliefs, behaviors, emotions, and movement patterns, not just the tissues, creating meaningful, sustainable change. The Tier 1 knowledge course for CFT is a hybrid program. It's a 1-day self-paced online and 2-day in-person workshop. During the face-to-face days, it's highly interactive, no lectures, and you work through in-depth case presentations, discussions, using live recorded consultations to understand low back pain through the lens of biopsychosocial looking at the patient. The focus is on person-centered communication with clinical reasoning, asking what matters for this person. You develop practical skills in communication, functional assessment, behavioral experiments, and integrating education with meaningful lifestyle changes. This CFT workshop will encourage self-reflection and transform how you approach low back pain rehabilitation. After the course, you confidently can apply this approach in practice, listen more effectively, ask better questions, and identify the true drivers behind each patient's pain, not just the symptoms. I warmly invite you to join me in Riga on the 22nd and 23rd of May for the upcoming 2-day face-to-face CFT interactive workshop as part of the Tier 1 CFT knowledge course. I very much look forward to meeting you in Riga and creating together a great, interactive, clinically relevant learning experience.